Throughout our lives, we get used to talking about our needs and making our own choices. But growing older can mean losing touch with what we want. And few of us think about and plan for the end of our lives.
So I don't like talking about dying.
I would like my mum to die here, really.
A lot of people that go into hospital just want to come back here, home.
Well, nobody likes going in hospital, do they?
All I get from my family when I mention, Mum, don't talk about death, don't talk about death, but I'll say, no, but you've got to know my feelings.
All of us want different things that's important to us, and I think it's choice. What do we choose? We choose when we're well and fit. We need choice when we're dying.
To find out how to support tenants in extra care courts to plan for the last stage of their life, Housing 21 set up a research project in partnership with the National End of Life Care Programme.
It's really difficult talking about death in this country. It is a taboo subject. We really welcome the work that the government's doing through the Department of Health to allow us to talk about that and to encourage local authorities to develop the kind of partnerships at a local level with palliative care organisations, with district nurses. And what we can do within Housing 21 is to ensure that our staff are well trained and confident enough to know when people do want to talk about it, to pick up those clues.
Housing 21 care staff aren't medical specialists, but they do know their tenants and have well-developed professional care skills.
In extra care, we've got care staff on site who have supported older people for many, many years. In this age of dignity, personalisation, giving people choices, we wanted to demonstrate that the care staff that are competent, that are trained, who are on the site 24 hours could actually support people through that very sensitive, critical time.
For Betty and Bob Burrows, the move to an apartment within an extra care court is part of the process of planning for the later stages of life.
As far as how we want our last days to be, we have discussed it with each other, but not necessarily with the family, because we feel we're very fortunate at the moment. We've got each other.
Sometimes the closeness of family ties and our concern for each other's feelings stops us talking about uncomfortable situations and hinders our understanding of what's needed.
If Bob was to go first and then Betty was left, I know that she doesn't really want her family to care for her. She would rather have like palliative nurses in.
I don't think it's that nice to talk about. I think there's a lot of better things in terms of what's more comfortable to talk about in here and now. But of course it is a reality that it's not so pleasant, and it's something that it's probably important to talk about.
We are perfectly prepared to sit and
discuss the matter.
Not only to discuss the matter, but to formulate our plan and let them have it in writing if need be.
So how do we approach such a difficult subject? And are there any particularly sensitive areas?
How can we make sure that people's wishes and preferences are met if we don't ask them? Professionals in health and social care are mindful that you don't make decisions on behalf of other people and make assumptions of what they would like. Sometimes you don't need to be as blunt as saying at the end of your life. You need to find a common language that people are comfortable with. You can say, when you become more poorly, is there anything that you would like us to make note of with regard to your care plan?
I think I've seen enough of hospitals. Don't particularly like being in them. Not that I've had any bad experiences, because I haven't. It's just the idea of, I don't know, I feel better at home. I can dance in here if I want to.
Acute illness often does mean hospital care and treatment. But hospital doesn't always have to be the place in which we end our lives, especially when we've expressed a wish to be at home.
Dying is a social event. It happens to all of us. And I think talking about it and being able to accept it, and that grieving is also a normal part of that, is so important.
It's a difficult process, and we have to allow space and time for strong emotions.
I'll be quite happy to die in here. I like the place. I like the staff. The staff are marvellous. And I've just lost a wife, which was an awful blow. But someday we'll be together. I was married for well over 50 years. There's a photo of the family there. But they're quite happy for me to be here.
Above all, we should make our plans in good time, when we're clear about what we want. And that might include reassuring people that they can change their mind.
We can openly discuss it when people are in control, when people are still alert, when they can still make those decisions, and support them to plan for end of life. Then we can share that with families. So families are aware of what their mother or their father actually wanted.
But even within families, expectations can differ.
Conflicts have been in the past where we didn't have anything in place and the family was making decisions because they had to, nobody else had. And you know in your heart of hearts that actually that's not what they wanted, but you couldn't really argue with the family.
Whoever we are, whatever our age, Housing 21's partnership with the End of Life Care programme is committed to improving the quality of end-of-life care and to giving us choice over what happens.
When we're talking about the end of life, we mean the sort of last year, not just the last few days or hours. It's actually how we give care to people like you would want for your own.
We don't all live our lives in the same way. While some of us plan ahead, others prefer a more responsive approach. What counts is understanding individual needs.
Not everybody's a planner. We've got to recognise that people are different. So for people who want to think about that and plan that, we have to have the apparatus for them to be able to do that. But not everybody wants to. I mean, I was thinking that myself, would I want to put together a plan? And it's quite hard to consider. And, you know, I talk to my dad, who's 82, about the work that I'm doing and about this project. But I find it very difficult to then engage him and say, but Dad, you know, what do you want?
Though sun or moon, I cannot be to make the whole world bright. I'd find some little chill spot and I shine with all my might.
Living in an extra care court means we've made a choice about where to live, in a place of our own. And it should be somewhere we can stay till the end of our days, surrounded by a family of carers.
This is their home. Why should we say to them, you know, you've got to end your days in a hospital bed or in a hospice somewhere? Why can't they be in their own homes with their family around them? And this is what we try to create on the extra care schemes.
What matters is knowing that those around us understand what we want.
Well, the worst thing that I could think of, and probably that my mum would think of, is to be here on her own when she was dying.
Aye, that's it.
And I feel that if she was to die here, the carers would be there with her, and they would inform the family straight away to come here and stay with her till it eventually happened.
Making opportunities to talk and plan for end-of-life care takes a while, but now is the time to do it.
The strategy is a 10-year strategy. We're not going to change things overnight. But I think what's really important is that we all take responsibility, and I mean we all, wherever you are, general public, people who work in care, whether that's social care, healthcare, housing, and I think it's going to find out where you can get that information from.
There is a resource pack for care staff and professionals produced by the End of Life Care programme and Housing 21 that offers some clear guidance.
The resource pack itself gives a lot of guidance and a lot of pointers, if you like, in the right direction to where staff can access information, to give them support to keep their residents where they'd like to be, which is at home in their normal place of care.
Within an extra care setting, there's a real opportunity for health and social care teams to work together, to develop a partnership approach that answers individual needs.
It's so important to communicate with who we're working in partnership with, and that's the hospitals, the social workers. Any change, any wishes, any conversation that they've heard that the 10 wants, it's really got to be about the person. And Housing 21, in our extra care courts, we work on a personal centred, and it's all about the person.
It's what they want. You might think, oh, well, we need a doctor, we need a nurse, we need a carer in there. That person mightn't want anybody there. You've got to be customer-led. It's got to be up to them. It's focused on the person themselves. And as long as we keep that in mind, I think we can work brilliantly.
By working together, we can ensure that the end of our lives is a time of peace and compassion. that each of us gets the care we need in the place we choose to be.
When you're born, you get lots of attention, lots of love, and I think it should be the same at the end of your life.
I would like to be at home. Definitely like to be at home.
My wife died here. I lost her 3 years ago. But they couldn't have cared more for anybody than they did for her. They were so kind.
There's more information about key issues in the film at this website.